Hey everyone, this is Taylor Lewis with the Pulmonary Performance Institute, and today I want to come to you and show you two exercises that if you superset together can be very beneficial for pulmonary conditions, and I want to give you a little bit of reason why. So when we think about breathing and we think about posture and we think about just daily movement, well, what happens is when we breathe in, our body is going to extend up and usually rib cage expands out, and then we exhale, ribs down, pelvis is going to tuck under, and all of a sudden we're going to have this kind of neutral position, and our weight is going to be kind of in the middle there. Now, if our breathing increases, what that's going to do is it's going to drive this extension, ribs are going to flare up, but we have to think about our center of mass, and what our brain's going to do is it's going to tilt the pelvis forward, and then all of a sudden we're going to be leaning forward, and then all of a sudden we're going to drive even more extension, and then we're going to have this really excessive lumbar extension, shoulder blades are going to change, our posture changes, and our center of mass is going to change. Now, to combat that, what we want to think about is dividing our front and back halves into an anterior side and a posterior side. Now, if you start to see yourself with that driven extension position, well, what's going to help is pulling the rib cage down, getting the pelvis under. Now, stuff to work with that is we're going to work more of the posterior chain. What that means is I want some more hamstrings, I want some more glutes, and I want some mid to upper back. Two exercises that are phenomenal for that is what we call hip thrusters, where it works hamstrings, glutes to really tighten and get them strong. And then we have 3-point stance one-arm rows that really work the rhomboids, posterior shoulder, and really fine-tune this backside. Because once again, we want to think about, we want our weight in more of the middle position. Okay? So once again, when we excessively breathe, it's going to drive us back, but then we're going to shift forward, because if we go too far back, we're going to fall over. So our brain's going to change our position, then all of a sudden we'll start to feel we use our quads a little bit more. So think about working that posterior chain a little bit more, and here's a couple exercises to help you do that you can actually superset together if you would like, or do them separately, however you want to program it.